Welcome to The Explainer. Now, if you follow health and science at all, you already know that next-generation metabolic drugs have completely taken over the cultural conversation. But today, we're looking at a recent medical breakthrough that really peels back the layers on what these drugs are actually capable of. We're talking about something that is actively reshaping modern medicine literally as we speak. Let's get into it.
What if the world's most talked about weight loss drug could also help you breathe? Crazy, right? It really challenges our preconceptions. For a while now, we've kind of boxed these medications into a very specific corner, mostly focusing on the aesthetics of weight loss or managing blood sugar. But the recent clinical data surrounding Eli Lilly's Tirzepatide suggests something much more profound is happening inside the human body. This isn't just about dropping a dress size or tightening a belt anymore. This is about fundamental systemic healing. Here's our roadmap for today's explainer. First, the weight loss baseline. Second, the sleep apnea threat. Third, Tirzepatide's dual action. And finally, the new therapeutic horizon. All right, let's jump right in.
Section 1. The weight loss baseline, beyond the zeitgeist. Okay, let's dive into this. So Tirzepatide is Eli Lilly's next-generation GLP-1 and GIP receptor agonist. You're probably already super familiar with its famous counterparts, drugs like Ozempic, Wegovy, or Lilly's very own Mounjaro and Zepbound. We know they have unprecedented efficacy in treating obesity and type 2 diabetes, right? That is our baseline.
But here's the thing. Weight loss is really just the tip of the iceberg. The whole cultural fixation has been almost entirely focused on the scale. Beneath the surface, though, lies this massive foundation of metabolic impacts. Sure, the weight loss is highly visible. It's what everyone talks about. But what this drug actually does internally to the body's cardiovascular and respiratory systems, that is where the true medical revolution is hiding.
Which brings us to Section 2, the sleep apnea threat, the hidden problem.
30. I want you to imagine the terrifying reality of waking up 30 times in a single hour. Imagine drifting off to sleep, only for your airway to completely collapse. Your brain panics, your oxygen levels plummet, and you literally gasp yourself awake. Now imagine your body doing that every 2 minutes, all night, every single night. That is the actual reality for patients suffering from severe obstructive sleep apnea. It is a state of constant, absolutely exhausting physiological panic.
We really need to reframe how we think about this condition. Sleep apnea is not just some annoying snoring nuisance. It is a severe metabolic threat. Think about it. When your body is constantly starved of oxygen and your sleep architecture is totally shattered, it triggers this massive cascade of negative health effects. It spikes your blood pressure, strains your heart, and actively worsens insulin resistance. It's this vicious cycle where obesity worsens sleep apnea, and sleep apnea makes it biologically harder to maintain a healthy metabolism. The stakes here are incredibly high.
Moving into Section 3, Tirzepatide's dual action, the breakthrough. Now, what's really interesting about this next part is what the clinical data reveals.
Let's compare the findings reported in the source data. Without Tirzepatide, a patient with obesity and sleep apnea experiences highly fragmented sleep, constant waking, and just immense metabolic strain. But in the clinical trials, patients treated with Tirzepatide saw something pretty remarkable. Not only did they lose weight, but they experienced significantly curtailed apnea events and much better breathing. We're seeing a dual threat relief being reported here. Now, we are simply analyzing the manufacturer's clinical trial results, but the data clearly indicates the drug is addressing both the root cause of the excess weight and the compounding mechanical issue of that collapsed airway.
The manufacturer is actually actively repositioning the drug's primary capability right now. As the headline reads, Eli Lilly says next-gen obesity drug curbs sleep apnea among other benefits. They aren't just selling a weight loss injection anymore. They are formally seeking to establish this as a legitimate treatment for a critical respiratory and sleep disorder.
To really grasp just how profound this is, think of Tirzepatide as the Swiss Army knife of metabolic treatments, right? You don't buy a Swiss Army knife just for the toothpick. You buy it because it literally has a tool for almost every situation. Similarly, this medication is demonstrating an incredible multifunctional nature. It's pulling a lever that regulates insulin, a lever that reduces appetite, and subsequently a lever that clears the airway and restores restorative sleep. It's essentially a single intervention doing the work of multiple disparate therapies.
Section 4. The new therapeutic horizon, other benefits. Let's move to the next slide and see how this builds out the larger picture.
Beyond just sleep apnea, obesity, and diabetes, the medical community is intensely focused right now on broader metabolic healing.
Researchers are actively investigating how reducing systemic inflammation through these mechanisms might impact cardiovascular events, kidney disease, and even liver health. As it turns out, these secondary therapeutic benefits are proving to be just as vital as the primary ones.
And this therapeutic horizon is expanding incredibly fast. Just think back to 2005. The very first GLP-1 medications were introduced strictly as diabetes treatments. Fast forward to 2021, and the approvals for highly effective obesity management kicked off the whole next-gen weight loss era. Now here we are in 2024, and the clinical data is pushing us straight into the sleep apnea and metabolic horizon. In less than 2 decades, the scientific understanding of what these hormone agonists can actually do has just exploded.
So, the crucial point is, we are witnessing a monumental shift in modern pharmacology. We're moving from single-target, vanity drugs directly toward holistic metabolic healing. We are no longer just treating a symptom or, a number on a scale. Based on the data emerging around Tirzepatide, we are treating deeply interconnected bodily systems that heal together.
Which leaves us with this final thought. With drugs showing the ability to treat diabetes, severe obesity, and sleep apnea simultaneously, are we looking at the end of single disease treatments? As we uncover the deep interconnectedness of our metabolism, the future of medicine might just be a completely unified approach to systemic health. Thanks for joining me for this explainer. Definitely keep an eye on this space.